Hey everybody, good afternoon. This is Maggie. I'm here with Dr. Henry Ellis, and we're here for another Facebook Live. Welcome.
Thank you for having me.
We're so happy to have you. We're actually at our North Campus today, which is a new location for Facebook Live, and we're here to talk about sports injuries and hip conditions. So let's get started. What are the most common injuries in hips for young athletes?
Well, by far the most common injury is a strain of your muscles or tendons around your hip joint. And really it depends on what sport you play.
Right.
Because with football and soccer players, oftentimes you have what we call an adductor strain, which is a strain of the muscle on the inside of your thigh. It can be very, very painful. Some runners and dancers and gymnasts, they have more of your hip flexor strains, which is on the front part of your thigh. Now, what we've learned more and more recently is sometimes some overuse conditions in the hip sometimes can mimic a strain. So deep down inside your hip joint, it may sound like a strain, but you may have a tear of your cartilage or even your labrum. And over the last 10 years, we've really learned quite a bit about those types of injuries as well. I'll have to also say, now that we're coming up on all these fall sports, that some of these cross-country runners, they haven't been training too hard this summer. So if they start up in the fall, we'll start seeing some stress fractures as well. So we really have to watch out for that as well.
So you were saying that depending on the sport, that kind of determines these most common injuries.
Yeah.
So then is there different treatments for these different injuries dependent on the sport?
Yeah, so when you have a strain of a muscle around your hip, probably the most traditional treatment that we oftentimes neglect is just good old-fashioned rest. Because really taking yourself out of the game and allowing that muscle to repair itself is probably the most important thing that we can do. You know, most of these strains around the hip joint, they have a really high recurrence rate. And oftentimes it's because an athlete tries to get back out on the field too quickly. So you really got to give it adequate rest. Now sometimes, if it heals or you have a really large strain, it can really scar in and make your hip really tight. So it's really important to not only rest it, but to stretch it and to move it well. And as it starts to repair itself, you'll feel yourself getting better, you'll feel yourself walking better, running better, and by that time you should be able to start getting back to practice. But the important part is not to go back and play until you're fully healed.
Right. Well, that's hard too, because I mean, with young athletes, they're wanting to go, do multiple sports.
They always want to get to the next game, and
right.
you know, especially the coaches put a lot of pressure on them,
Definitely.
so it's really hard to balance it all. But if they go back too early, the problem is these strains, they'll just keep
right.
on occurring.
So I know that we're talking to a lot of parents about this. This is our big audience. So what could parents be doing to help out with their young athlete and making sure that they're an advocate to make sure that they are resting and watching out for these different signs of these injuries?
Yeah, well, as you know, good old-fashioned injury prevention is probably just as valuable as the treatment alone. And so the more we can learn about how to prevent these, the better off we're going to be.
Right.
So, you know, off the top of my head, I have 3 good tips. One of which is your kid or your child's about to start off on their athletics sometime early in August, maybe even next week. You got to be sure they don't start cold. If you start cold and your body is cold, you're going to really find yourself prone to injuries, not only you know, what we call acute traumatic injuries, but also these overuse injuries as well. So you really got to plan yourself and work up to the training with the school, particularly some of those football players, soccer players, and even some of the cross-country runners as well. The second thing is proper stretching. You know, oftentimes we focus a lot on our hamstrings and our quadricep muscle, but we forget about the hip. Now, what you may or may not realize is the hip, just walking and running, it withstands about 6 to 8 times your body weight.
Wow.
So, you know, the muscles around your hip, they really do a lot of work, particularly when you're on the field. And so when you stretch your hamstrings and your quads, don't forget to neglect to stretch your hip, some of the muscles and ligaments around your hip too, because that will really help as well. Probably the third most important thing is not to play with pain. Sometimes we get in the habit of maybe taking some Motrin or ibuprofen before and after practice, but if you're having hip pain, it's just most of the hip pain that we take care of here, it will continue to get worse until you adequately treat it. So sometimes taking 2 weeks off will do better for your hip than trying to live with lingering pain over 6 to 8 weeks and then end up finding yourself taking more time off.
Wow, yeah, I mean that's good information, because I think parents are always wanting to know when are they supposed to be looking for. So what should we be telling parents about when should they come see a specialist like you?
Well, I think, there are really two different types of hip pain that we think about. A hip injury that occurs after an event. I tackle or I kick the ball, I feel a pop, or I was running on my 4th mile and something immediately happened to my hip and they really recall an event. I think that often those times are okay. As long as they can put a little bit of weight on it and sleeping overnight and kind of reassessing the next morning. If they continue to have pain or they develop a limp, boy, I really think they need to be seen. There are other types of hip pain that maybe linger on. Maybe my hip pain started when I was doing squats and it gradually got worse and it gradually got worse. Well, I think if you give yourself rest or you change your exercise a little bit and that doesn't change your hip pain, you really got to come in and see us. Or if your pain continues while you're doing your same sporting activity. Now I get a lot of questions on popping of the hip. So popping of the hip really occurs quite a bit. And painless popping oftentimes is not something we worry too much about. In fact, there's a condition called snapping hip syndrome. And I have athletes come in here and they say, my hip feels fine, but it just pops. And they'll say, see, show me how. And they'll move their leg around, they'll show you how their hip pops. And it's actually quite frequent. We see it in runners and gymnasts and dancers. And there's two different kinds. There's one on the outside of the hip where they have the snapping, popping sensation on the outside, and sometimes they have that snapping sensation in their groin. Now, most of these are muscles, or actually most of them are tendons that snap around the hip capsule, and that's what causes that snapping effect. Now, remember what I said, those are mostly painless popping. Painful popping actually can be a little bit more of a concern. Painful popping not only can also be a snapping hip syndrome, but sometimes things deeper in your hip joint, like a labral tear or a tear of your cartilage, or maybe a more serious injury to the bony structure around your hip, can cause that painful popping sensation. So I would have to say that the painful popping probably needs to be seen by an orthopedic surgeon or a hip specialist.
So then if they have this painful popping, obviously it depends on the patient and what's going on kind of during their lifestyle, but what are some of the recommendations you give them when they come in? Is it still this stretching, you're observing it, or is there ever a chance of surgery for maybe a labral tear or anything for that matter?
So if the pain, when we think about the hip, we think of the muscles and tendons around the hip joint, and then we think of the hip joint inside of the hip joint. And so the muscles and tendons around the hip joint are where we see some of these strains and some of this popping that occurs. So if you think about it, one of the popping sensation in your groin is actually a big, long muscle and a tendon that attaches right here. Okay? And as you rotate your hip around, it actually pops on the front part of your hip joint. Now, that's a really easy treatment because oftentimes that means your hip flexors are just too tight. So you got to be really diligent about stretching them out. Okay? Now, the other type of popping sensation can be from the outside of your hip here. And a lot of athletes know that they have a tight IT band because we see it a lot, but sometimes that IT band is so tight it actually rubs up against the outside of the bone of your femur, which is the ball, is the bone on, is your thigh bone right here. And so as it snaps around this portion of the bone, that also can be painful. But the good news is, that's stretching as well. The foam roller works absolute wonders in this area, as well as stretching it out. Now, like you said, sometimes you have popping inside your hip joint right here. The hip is a ball and socket joint. So inside your hip joint here. Now, if you have a labral tear or a cartilage injury, doesn't always mean you need surgery. But it probably need a pretty good plan, and an orthopedic surgeon to help you get through that.
So if that is the case, what tests would you guys do? Would you do an MRI or a CT scan to kind of see what's going on inside there? What could people expect?
Yeah, well, I think sometimes in the clinic setting now, we have certain physical exam maneuvers that really help us figure out, is it coming from a muscle or a tendon outside the hip joint, or is it coming deeper inside? And so in the clinic, we can usually have a pretty good idea of where it's coming from. If we think it's coming from inside the hip joint, oftentimes we'll still treat it with rest, maybe look at their strength and their flexibility, and perhaps physical therapy. Far beyond we need an MRI. Now, if that doesn't seem to be working, or we have another hunch that something more serious is going on, an MRI is certainly a great diagnostic tool that lets us really see all inside the hip joint. And I can't reiterate enough, even if you have a labral tear, doesn't necessarily mean it needs to be surgically fixed, but it does mean it needs to be looked at.
Okay. So you were talking about popping and snapping. So what about if an athlete comes in and has a limp, but is not really complaining of pain, but has some kind of limp going on? So how is that different than the popping and the snapping, or does it go one and the same?
Well, it can be. Sometimes, kids limp for a lot of reasons. And parents usually tell us that their kid limps, and sometimes the kid doesn't even realize he's limping. But there are conditions of the hip joint that we worry a lot about. And sometimes they're not painful, and the first sign is a limp. Okay. And so a teenage or a growing athlete, typically older than the age of 10, that has a little bit of a limp, nobody really knows where it's from, probably needs to get evaluated by an orthopedic surgeon. Okay. Again, if it's after an injury and you feel like it's a minor bruise, I'd probably monitor it for a little while. But if you notice your child's having a limp and it seems to be gradually worsening or associated with activities and we don't really know where it came from, I think there are certain kinds of stress fractures and developmental processes that occur around the hip that may be able to be screened at that point. Right. And we've had on Facebook Live, we've seen Dr. Kim and Dr. Pedezzo and Dr. Sacato talk about some of these conditions. So if you're concerned about some of these developmental conditions at the hip that can occur in adolescence, you may want to go ahead and take a look at their Facebook Live video as well.
That's awesome. So I think to kind of wrap things up a little bit, I know research is a really big part of sports medicine and what we do at Scottish Rite Hospital. So with these different hip injuries, is there some research that we're doing to kind of help monitor some of the injuries that come in for our athletes?
Yeah, we're always looking at ways in which to improve our athletes. And, historically, we've done a lot of research on our treatments. Okay. And what the sports medicine department here is we still do research on our treatment, but we're putting a lot of energy into how do we prevent these and how do we identify these problems before they start. Now, sometimes athletes don't want to hear that, but there are really important things that we can do that can really maybe avoid a potential injury or even a potential surgery, some of these problems. And what we really learn more than anything else, not only research here, but research across the country, is that, we're pushing athletes really hard at a very young age. And so we still believe very, very strongly that sports specialization is really important and not to do the same sport year in and year out. An example is like in hockey players. Hockey players have a really high incidence of having what we call femoral acetabular impingement, or when your hip joint develops some extra bone to where it pinches on your hip joint and can cause a labral tear. Oh, okay. This process typically occurs when an adolescent hits his growth spurt. And so if you play too much of one sport and you put your hip in the same position throughout the entire year without giving yourself an off season, it really increases your risk of having these conditions. So every sport really needs to have an off season, and it's really important to try to give your child some variety in what they do.
That's awesome. Really great information. We're so happy that we could be here with you today and learn more about sports medicine and everything that you specialize in. So stay tuned. Next week we'll be back talking more about hip conditions. Thank you.